Hi, this is Dr. Rex Hamilton from the Santa Monica Eye Medical Group in Santa Monica, California. When I'm presenting options to a cataract patient, I will ask them specifically what their lifestyle activities include. And that serves several purposes. Number one, it allows me to guide the choice of which lens option is best. But it also allows me to develop a rapport with a patient. Maybe a patient's a photographer, in which case I will point out that colors are going to be dramatically different to that patient. Maybe they read the Wall Street Journal every morning, or maybe they are a designer and work with clothes, or maybe they're interior design. So I like to find out what the patient's hobbies are, what their occupations are, and then I like to tailor the discussion of the IOLs to that particular patient. And in general, I like to point out the fact that the extended depth of focus lens, if the patient is a candidate for that lens, is the choice that I strongly recommend. So I really enjoy seeing patients on day one because the look on their face and the smile on their face really tells the whole story. Probably the most common comment is, "I can't believe the colors. I didn't know that my drapes were that color," or "I didn't know that my couch looked like that," or "I didn't know this outfit I had on, it doesn't match." And they're just blown away by the change, which is instantaneous. And then oftentimes they will tell me that they haven't seen this well their entire life. And that was always something very dramatic to me. And that speaks to the quality of the optics in the TECNIS family of lenses and how incredible it is in terms of clarity, contrast sensitivity, and the ability to see in dim light. I think that latter point, the dim light vision, is what really sets apart the TECNIS family of lenses versus the other lenses. Light in a restaurant looking at a menu, light inside your house is really dim light, and we want to have excellent vision in all lighting conditions. And that's something that the patients routinely report when I use any of the TECNIS family of lenses. I do a very high percentage of premium presbyopia correcting IOLs in my cataract patients, and I make that choice. And there's a very simple reason for it. I feel like I owe that patient the opportunity to have that lens in their eye. One-time shot, cataract surgery, we don't repeat it. And I have to choose a lens to put in your eye. I want to put the lens in that's going to give you the most amazing lifestyle advantage that I have available. And that is the extended depth of focus lens. And then I feel comfortable, and I feel that I did everything I possibly could for that patient to give them the best opportunity. And the reason that I feel that way is the confidence I have in that choice based on my past experience with patient outcomes, the word of mouth that it has generated for my practice. It's very clear to me that that is the choice that is best for the patient. And so I can make a very firm recommendation and feel very comfortable with that with my cataract patients.